Hi, my name is Amanda Powell, and today I am going to be discussing the safe transfer of the bariatric patient. So, my unit on labor and delivery has had recent problems of staff injuries while moving and transferring bariatric patients due to a lack of equipment and additional hands. A few months ago, a bariatric patient was being moved from the operating table to a stretcher via a lateral transfer maneuver after a C-section. And somehow the patient rolled onto the floor on top of one of the staff nurses. It took a great deal of effort to get the patient back on the stretcher, but luckily she did not have any injuries. The nurse, however, suffered a back injury that is still affecting her to this day. Now, because of the lack of necessary equipment and knowledge needed to safely transfer and reposition bariatric patients on the unit, I wanted to bring awareness to the staff as well as to teach them appropriate ways to manipulate bariatric patients without the risk of injury. So, the goal of my project is to design, implement, and evaluate an education pamphlet on safe patient transfer techniques of the bariatric patient after a C section to increase patient safety and decrease staff injury. So, how will I do that? I have three learning objectives to guide this project. So, first, I analyzed nursing journals to find data on staff and patient injuries related to transferring and repositioning bariatric patients. I also researched equipment made for transferring bariatric patients as well as methods to remain safe while doing so. Next, I designed and created an education pamphlet for each staff member to be used as a reference when needed to care for a bariatric patient. And then finally, I evaluated the effectiveness of the patient transfer pamphlet, and we'll talk about how I accomplished this in the next couple of slides. So to start this project, I needed data and information to guide me in the right direction. I reviewed and summarized 5 nursing journals, all of which gave me relative information for my project. Next, I reviewed the current hospital policies regarding repositioning and transferring of a bariatric patient. This policy stated that the hospital must provide adequate staff and equipment to perform these transfers. Unfortunately, this is not the case due to staffing issues that we are clearly seeing across the profession. I then took the information I had gathered and created an education pamphlet. We will take a look at this on the next slide. But during my presentation and after giving out the pamphlet, I demonstrated the correct use of the air mattress transfer device and had the staff take turns being the patient and nurses. So basically, an air mattress transfer device allows the patient to be lifted by air and then easily slid from one bed to another. Since this device is typically kept in the main OR at this hospital and not the labor and delivery OR rooms, many of the staff nurses had never used one. Finally, I handed out a survey for the participants to complete. This is shown here on the right-hand side of your screen. I included 2 fill-in-the-blank questions as I had hoped to get some detailed feedback here. So here is a screenshot picture of the pamphlet that was given out to the staff. Here I presented some statistics regarding staff injuries. It was really surprising to me and to the staff to learn that 50% of staff nurses have considered leaving the profession due to the risk of injury. It's pretty big. So I think this was good information for my participants to hear because it made them feel like they weren't alone. Additionally, it brought to light the need for change. The pamphlet also discussed the 3 main types of transfer devices the hospital offers, their uses, and then also where they can be found in the hospital. A major point that I brought to the presentation was the idea of a lift team. So, a lift team is defined as 2 physically fit people who are competent in lifting technique and work together using mechanical equipment to accomplish high risk patient transfers. So, in this instance, it would be the bariatric patient. A recent study found that by implementing a lift team on the unit, career injuries were decreased by 38%. I think that's pretty substantial. Additionally, nurses are utilized more efficiently, and patients have overall better quality of care when a lift team is implemented. The last thing I want to mention here is the respect method. I know it's a little small, so I'm going to go through kind of what it talks about. The method is really just a guide to ensure the highest safety for both the nurse and the patient. So we'll just go down the letters here. First, you want to spend time with your patient to build a rapport, and you want this rapport to be based on trust. Next, you want to ensure you have the proper equipment. And then also, you want to make sure you have the proper environment to use that equipment in. Safety is number one key. So, address concerns as they arise. If you notice something is off or if you have a question, stop what you're doing and address the concerns immediately. You want to treat your patient with dignity and provide them with privacy that they deserve. You also want to encourage your patient to stay motivated, to help, and to help where they can. So, can they lift themselves with their arms? Are they able to scoot a little bit? You want to encourage them to participate in their care as much as possible. Provide a caring attitude with respectful care. And then finally, you want to talk to your patient with a tactful dialogue. And this just means to speak to them without offending them or without putting them down. Next, we have outcomes. So there were many outcomes to this project, and I would say that most of them were positive. First, I want to talk about awareness. Awareness was brought to the unit administration, and this was huge. Working on the unit without enough nurses available for assistance with patient transfers has been an ongoing problem on this unit. Additionally, the lack of available equipment, as well as the lack of education on how to use the equipment, has also been a problem the unit nurses have previously tried to address with administration. This project brought light not only to the staff nurses, but to upper level management as well, which is huge. Next are the lift teams. So because I did my project in a military hospital, the application of such teams takes a long time and must be approved up through the chain of command. So because of this, a lift team has not been officially created at this point. However, nurses are nurses are on the unit. They're excited about it, and they really are excited about the possibility. They're interested in finding ways to make it official on the unit. Finally, I realized that despite my efforts, there will always be things that I can improve on. So it was a challenge to get people to fill out the surveys. I think in the future, I may talk with participants face to face in a more casual setting to get my feedback instead. Furthermore, the amount of time that I had to present was really strained. Trying to give new information during huddle to a group of nurses who were eager to start their day, ready to see their patients, it just wasn't the most effective time to do the presentation. This unit does have quarterly mandatory staff meetings, so I think that would have been a better time for this type of presentation. I would have had more time, and then there would have been a lot more nurses there to receive information as well. Day shift, night shift, everybody would have been there at one time. Next, we'll talk about the application of the project. So there were many applications that went into making this project a successful one, which I would consider successful. First, data was presented to staff to show how much of a problem injuries are when transferring patients. Additionally, using data to show that by using proper techniques and assistive devices, the risk of injury is dramatically decreased. Supporting the patient's needs is done by treating the patient with dignity and respect for not making them feel bad about the situation. Supporting the nurse's needs by providing adequate equipment and helping to make transferring bariatric patients a safe process. Like I said before, the teams were not officially implemented, or the lift teams, excuse me, were not officially implemented. However, the seed has been planted, and I am hopeful this will become a standard among the unit very, very soon. Next is the value of the project. So lifelong learning is something that comes with the territory in the nursing profession. Continuing education is important as there is always new research being done based on evidence-based practice. It's important for us to remember that even though we have done things a certain way for a long period of time, doesn't always mean it was the best way for our patients. So if we stay educated on top of the most up-to-date information, we can then share that information with our peers and we can encourage each other to be better. Finally, using our voices to speak up when there is a safety concern. Many times, administration may not be on the floor to see that there is an equipment problem, for example. So, using our voice to advocate for the safety of our patients as well as for ourselves, it really makes all the difference. Thank you so much.